السلام عليكم ورحمة الله وبركاته. أهلا بكم أعزائي طلاب وطالبات الفرقة الثالثة بكلية الطب في محاضرة جديدة من محاضرات النيورو أناتومي. Today in this lecture we will discuss the third ventricle, the fourth ventricle, and the cerebrospinal fluid circulation between the different ventricular system. Last lecture we have discussed in details the relations between the lateral ventricle and the different parts of the caudate nucleus and also the thalamus and in relation to the internal capsule. Today in this lecture we will discuss the relations of the third ventricle. First we have to outline the boundaries of the third ventricle. It's much easier than the lateral ventricle. The whole relations of the third ventricle could be described from the sagittal section. This is a photo of the sagittal section, and we can from this photo we can identify the roof, the anterior wall, the floor, and posterior walls of the third ventricle. So where is the third ventricle? It is the space which lies between the right and the left cerebral hemisphere. So to outline the boundaries of the third ventricle, this is the outline of the third ventricle. The roof of the third ventricle are lying here like this. So to begin with the roof, here we have the thalamus. Okay? Between the right thalamus and the left thalamus, we have a thin layer of ependema. This ependema is stretching between the right and left thalami and closes the roof of the third ventricle from above. Okay, more superior we have this structure. I am sure that you have known or identified this structure, which is the fornix. The fornix is another commissural fiber which joins between the right and the left cerebral hemisphere, and above the fornix you have this layer which is the septum lucidum that closes the cavity of the lateral ventricle, and the septum lucidum is stretched between the corpus callosum above and fornix below. So this is the roof of the third ventricle, beginning with the ependema and then fornix, septum lucidum, and corpus callosum. Okay, what about the anterior wall of the third ventricle? The anterior wall of the third ventricle begins with this structure, which is the anterior column of the fornix. The fornix, as you know, the fornices are formed by the efferent fibers of the hippocampus. So the hippocampus lies on the inferior surface of the temporal lobe in the parahippocampal gyrus, and this structure, the hippocampus, is forming part of the limbic system. The efferent fibers of the hippocampus are collected to form the posterior column or the crura of the fornix. Then the fornix is curved over the thalamus to form the body, and then anterior to form the anterior column of the fornix. Deeply into the cerebral hemisphere, the anterior column of the fornix is joined to this nucleus, which is the mammillary body. It is the nucleus of the hypothalamus. But this is not on the sagittal section of the cerebral hemisphere. This is deep inside the cerebral hemisphere. It is joined by a tract, which is very important in the limbic system as well. Okay, so the first part that form the anterior wall is the anterior column of the fornix. And then to move inferiorly, we have this structure. This structure is the anterior commissure. If you remember last lecture, we said that the anterior commissure is a commissural fibers that joins between the right and left anterior part of the temporal pole in what's called pyriform fossae of the brain, which has an important role in smell function. So this is the anterior commissure, and the anterior commissure forms part of the anterior wall of the third ventricle. Moving downward, we will find this structure, which is a sheet of gray matter between the anterior commissure and the optic chiasma, which is number 5. This structure is called Lamina Terminalis. Lamina Terminalis is forming part of the nuclei of the hypothalamus. And this sheet of gray matter is stretched between the anterior commissure and the optic chiasma. So, stopping at the optic chiasma, this is the anterior wall. So, the anterior wall is formed by anterior column of the fornix, anterior commissure, and lamina terminalis. Then, the floor of the third ventricle. The floor of the third ventricle is formed by optic chiasma, this structure. The optic chiasma is formed by the crossing of the fibers of both optic nerves. So if you remember, the optic nerve is coming from the back of the eye, and then with the other optic nerve here, we have the optic chiasma, which is the crossing part between the two optic nerves. And then we have the optic tracts. The optic tracts are moving posterior to join the thalamus in the lateral geniculate body. This is the pathway of the vision, the pathway of the vision. Okay, so the optic chiasma is forming part of the floor of the third ventricle. And then moving posterior, we will find this structure, which is representing what's called tuber scenarium. Tuber scenarium hanging the infundibulum, which hangs the pituitary gland. So the tuber scenarium is an elevation, and it is a part of the hypothalamic nuclei as well. The infundibulum is hanged into the tuber scenarium, and the infundibulum is joined with the posterior lobe of the pituitary gland. Moving posterior or more posterior, we will find this rounded structure, which is the mammillary body. This is the last nucleus of the hypothalamus, and also represent part of the floor of the third ventricle. The last structure to form the floor of the third ventricle is this part here of the midbrain, and I'm sure that you know that this is the tegmentum of the midbrain. The tegmentum of the midbrain is the ventral part of the midbrain, and you know that this is a cerebral aqueduct of Sylvius, divides the midbrain into anterior part and posterior part. The posterior part is called tectum, and the anterior part is called tegmentum. So the tegmentum of the midbrain is the last structure to form the floor of the lateral ventricle. So again, to summarize, the floor of the lateral ventricle is formed by optic chiasma, tuber scenarium, mammillary body, and tegmentum of the midbrain. What about the posterior wall of the lateral ventricle, of the third ventricle? The posterior wall is formed by this structure, which is the pineal gland. The pineal gland secretes melatonin. Melatonin is responsible for regulation of the dark light cycle of the subject. And also, we have here in the lower stalk of the pineal gland, we have the posterior commissure, as we mentioned before in the lecture of the commissural fibers. This commissure has fibers that crossed from right to left cerebral hemisphere, and these fibers are responsible for the consensual light reflex, which is constriction of the other pupil in response to a source of light. Lastly, we have the cerebral aqueduct, which also forms a part of the third of the posterior wall of the third ventricle. So the posterior wall is formed by cerebral aqueduct of Sylvius, posterior commissure, and then the pineal gland. What about the lateral wall of the third ventricle? I'm sure that you know the lateral wall is formed by the thalamus and the hypothalamus. So this structure here is the thalamus, and here is the hypothalamic sulcus, which separates between the thalamus above and the hypothalamus below. and antero-inferior to the thalamus. This structure here is formed by the hypothalamus. Thalamus and hypothalamus are lying in the lateral wall of the third ventricle. So the third ventricle has two lateral walls and has no medial wall because it is a cavity. From this photo here, or from the sagittal section, you will find that the third ventricle is communicating with the fourth ventricle through this canal, which is the cerebral aqueduct, and also it communicates with the cavity of the lateral ventricle by this connection, which is the interventricular foramen, or foramen of Monro. Okay, these are the connections between the third ventricle and the fourth ventricle below, with through this communication, which is the cerebral aqueduct, and the interventricular foramen joins between the third ventricle and the lateral ventricle. And this structure here is white because here is the place or location of the interthalamic adhesion. The interthalamic adhesions are parts of the two thalami, which connect between the right thalamus and the left thalamus. So if you show the shadow of the third ventricle, as in this picture here, so the white circle in the center represents the place of the interthalamic adhesion that passes from the right thalamus to the left thalamus. So you have here what's called recesses of the third ventricle. Recesses like pockets inside the structures that form the outline of the third ventricle. So you have here what's called optic recess, which is in the place of the optic chiasma, and also here the infundibular recess, which is in the place of the infundibulum that joins between the tuber scenarium and the pituitary gland. And posterior we have suprabineal recess, and this in the recess or the pocket above the bineal gland, and lastly the bineal recess, which represents the place of the bineal gland, posterior. Okay. Choroid plexus of the third ventricle. If you remember, the choroid plexus is the structure which is responsible for secretion of the cerebrospinal fluid. The choroid plexuses are derived from the anterior and posterior choroidal artery. The choroid plexus of the lateral ventricle lies in the choroid fissure, which is in this place here, between the anterior column of the fornix, between the fornix and the thalamus. So this is the choroid plexus of the lateral ventricle. These are the two choroid plexuses in the two lateral ventricles. Remember that the choroid plexus of the lateral ventricle is in the choroid fissure, which lies at the medial wall of the lateral ventricle. But here, if you look on this picture, you will find the choroid plexus of the third ventricle in the roof of the third ventricle. So this is the roof of the third ventricle, and here you will find the choroid plexus of the third ventricle. You should know that the choroid plexus of the third ventricle is derived from the posterior choroidal artery, which is a branch of posterior cerebral artery. Okay. What about the fourth ventricle? The fourth ventricle is the diamond-shaped cavity which lies in the hindbrain. If we use the term hindbrain, so you will remember that the cerebellum and the brainstem in front of the cerebellum. This space lies between the cerebellum posterior and back of pons and back of upper medulla anterior. This picture here represents a half of the fourth ventricle. The other half should be in the other half of the brainstem and the other half of the cerebellum. So this is the half of the fourth ventricle. Okay. As you see, the fourth ventricle has a superior angle and also has an inferior angle, which is appearing on this picture. Also, it has two lateral angles. These two lateral angles are representing the connection between what's called cerebellar peduncles. So let's see first the superior angle. The superior angle is continuous with the cerebral aqueduct of Sylvius to be communicating with the third ventricle above. And the inferior angle is continuous with the central canal of the closed medulla and then the spinal cord. The two lateral recesses are these structures here, which are called the superior and inferior cerebellar peduncles. The cerebellar peduncles are massive tracts that connects between back of midbrain, pons, medulla, respectively, with the cerebellum posterior. So the tract that connect the medulla oblongata with the cerebellum is called inferior cerebellar peduncle. And the tract connects the midbrain with the cerebellum is called middle cerebellar peduncle. And finally, the midbrain is connected to the cerebellum through the superior cerebellar peduncles. These peduncles are forming tracts between cerebellum and the brain stem anterior. The meeting point between the superior and the inferior cerebellar peduncle, which is this angle here, the meeting point is forming one of the lateral angles of the fourth ventricle. The other one should be on the other half. So if you see a photo of the fourth ventricle from a posterior and after removal of the cerebellum, you will find the fourth ventricle like this, diamond shape. And this is the cut edge of the superior cerebellar peduncle. And this is the cut edge of the inferior cerebellar peduncle, which joins between the midbrain and medulla with the cerebellum posterior. And on the other half, this is the superior cerebellar peduncle and this is the inferior cerebellar peduncle. And this is the medulla oblongata here and different structures on the medulla oblongata. Okay, so this is the lateral recesses, or lateral angles, which curve around the inferior cerebellar peduncle, and these are very important in communication between the fourth ventricle and the subarachnoid space outside the ventricular system. We will mention these communications when we reach the section of the cerebrospinal fluid and communications of the cerebrospinal fluid between different ventricular systems. What about the roof of the fourth ventricle? The roof of the fourth ventricle is like tent shape, which is formed by a layer of, again, ependema stretched between the two superior cerebellar peduncle. So if you look at this picture and imagine that you have a layer stretched between the two superior cerebellar peduncle like this, this is called superior medullary veilum. So the superior medullary veilum is a layer of ependema that is stretched between the two margins of the superior cerebellar peduncle in the roof of the fourth ventricle. And also we have inferior medullary veilum, which is a layer of ependema stretched between the two inferior cerebellar peduncles like this in the roof also of the fourth ventricle. The inferior medullary veilum has a median aperture or a median foramen through which the cerebrospinal fluid escapes to the subarachnoid space. So we have three apertures in the roof through which the cerebrospinal fluid escapes from inside the cavity of the fourth ventricle to the subarachnoid space outside the ventricular system. We have two lateral recesses here at the meeting point between the superior and inferior cerebellar peduncles in the lateral angles of the roof, and also between the inferior cerebellar peduncles just in the midline here we have the median aperture, which is the median foramen. These two lateral foramens are called Foramens of Lushka. So the foramen of Lushka, we have two foramens of Lushka and one foramen of Magendie in the roof of the fourth ventricle. And as you can see here, this is the reflected cerebellar hemisphere to show the fourth ventricle. So you can see here, this is the floor of the fourth ventricle after removal of the complete roof, which is the cerebellum and the two stretched superior and inferior medullary veilum. So this is the back. We have here what's called medullary stria, which separates the back of pons from the back of upper medulla. And these are forming the floor of the fourth ventricle. If you imagine the roof of the fourth ventricle, so this is the cerebellum, and you have here, this is the cut edge of the superior cerebellar peduncle between the midbrain and the cerebellum. And also here you have the inferior cerebellar peduncle. On the other half of the picture, you have here the cut edge of the superior cerebellar peduncle, and this is the middle cerebellar peduncle, and this is the inferior cerebellar peduncle. And here, this is the stretched layer between the two cerebellar peduncles, two superior cerebellar peduncles, which is called superior medullary veilum. And down here, you have a thin layer stretched between the inferior cerebellar peduncles like this in the roof of the fourth ventricle to form the inferior medullary veilum. So here the roof is completed under cover of the cerebellum. And if you want to see the floor, you have to remove the cerebellum and the superior and inferior medullary veilum to see the back of pons and back of upper medulla lying in the floor of the fourth ventricle. What about the choroid plexus of the fourth ventricle? The choroid plexus of the fourth ventricle is forming a T shape, like this here, representing the choroid plexus of the third ventricle, of the fourth ventricle. It's suspended in the inferior half of the roof. So if you imagine, this is the cut edge of a superior and middle and inferior cerebellar peduncle. This is here the middle cerebellar peduncle, and this is here the inferior cerebellar peduncle. And here you, this is the superior medullary veilum between the two superior cerebellar peduncles. And here you cannot see the back of bones because this stretched layer is covering the back of bones completely, so you cannot see what is behind. In the other picture, this is the superior medullary veilum between the two superior cerebellar peduncles. But try to imagine the inferior medullary veilum. This is the inferior medullary veilum here, which is stretched between the two inferior cerebellar peduncle. And the choroid plexus is coming from the T-shaped tuft of blood vessels, which comes from this foramen here, the foramen of Magendie, and then divides to right and left limbs, like the letter of T. So it closes the roof of the fourth ventricle, or it lies in the roof of the fourth ventricle, but not in the upper half of the roof. No, it is in the lower half of the roof, which is formed by the inferior medullary veilum. The source of the choroid plexus in the fourth ventricle is the posterior inferior cerebellar artery. The posterior inferior cerebellar artery is coming from the vertebral arteries. So the vertebral artery, as you may know, has 4 parts, and the fourth part of the vertebral artery give what's called posterior inferior cerebellar artery, which will be discussed in the section of cerebellum. It's called PICA, posterior inferior cerebellar artery, and these two arteries are sharing in the formation of the choroid plexus of the fourth ventricle. So just to remember, the anterior choroidal artery and posterior choroidal arteries are responsible for the choroid plexus of the lateral ventricle, and the posterior choroidal artery gives the choroidal branches to the third ventricle, which lies in the floor, in the roof, sorry, of the third ventricle. And finally, the posterior inferior cerebellar arteries are forming the T-shaped layer of, or the T-shaped choroid plexus in the lower roof of the fourth ventricle. Okay, just to summarize or to test yourself, the structure, this shadow that is representing the ventricular system inside the brain. So this is the lateral ventricle here. This is the shadow of the lateral ventricle. And here is the communication between the third ventricle and fourth ventricle. So number one representing the anterior horn of the lateral ventricle, which lies in the anterior or in the frontal lobe. Number two is representing the body of the lateral ventricle. And sure, number three is the posterior horn of the lateral ventricle. Number four, the inferior horn of the lateral ventricle in the temporal lobe. Number five is representing the cavity of the third ventricle. Number six, representing the cavity of the fourth ventricle. And number seven is representing the connection between the cavity of the lateral and third ventricle, which is the foramen of Monroe or the interventricular foramen. And number eight is representing the distal end of the cerebral aqueduct between the third and the fourth ventricle. And this is the key for the previous picture. Okay, so now we will move to discuss what's called subarachnoid cistern. So I'm sure that you know you have three meningeal covering of the brain and spinal cord. You have from outside to inside, you have dura mater, arachnoid matter, and lastly pia mater. And also you have three spaces between these three meningeal layers. You have the subdural space between the dura and arachnoid. You have the subarachnoid space between the arachnoid and pia mater. Here you have the cerebrospinal fluid circulation. So the cerebrospinal fluid is completely circulating in the subarachnoid space between the arachnoid and pia mater. And you may know that you have some points which is in danger in different parts of the brain and brainstem. So to protect these very important structures, the cerebrospinal fluid accumulates inside enlargements of the subarachnoid space. This enlargement of the subarachnoid space, which is full of the subarachnoid of the cerebrospinal fluid, is called subarachnoid cistern. So wherever you find an important structure in the brain or brainstem, you will find a cistern to protect it. So the first cistern and the largest one, it's called Cerebello-Medullary Cisterna or Cisterna magna. As you can see here, this is the Cerebello-Medullary Cisterna, which is a very enlarged part of the subarachnoid space, full of the cerebrospinal fluid. It lies between the cerebellum and the roof of the fourth ventricle. Okay, so why it is important to protect here this structure? Because here we have an important structure. The cerebello-medullary cistern protects the vertebral artery and the origin of the posterior inferior cerebellar artery, which is the pica in this area, as we will describe the vertebral artery and the pica when we reach the cerebellum lecture. And also here in the cerebello-medullary cistern, the origin of cranial nerves number 9, number 10, and number 11, 12. And these are very important. So the cerebello-medullary cistern protects this very important structure. We have another cistern which is called pontine or pontomedullary cistern. Here is the pontine cistern in front of the pons here. This enlargement of the subarachnoid space protects the artery which runs in front of the bones, which is the basilar artery, and also the origin of the superior cerebellar arteries and the sixth cranial nerve, which is the abducent nerve. We have another cisterna which is called Inter-Bidancular Sister. The Inter-Bidancular Sister is located in the inferior surface of the brain, here, between the right and left tentorial surfaces of the brain. It protects a very important structure which is called circle of Willis. The circle of Willis responsible for the blood supply of the brain, and this circle joins between the vertebrobasilar system and the internal carotid system that supplies the brain. And also it protects the roots of third and fourth cranial nerves. We have cisterna of lateral fissure, and this cisterna lies on the lateral surface of the brain inside the substance of the lateral fissure, and it protects the middle cerebellar artery, which is a branch of the internal carotid artery. In fact, it's a continuation of the internal carotid artery on the lateral surface of the brain. We have another very important cisterna which is called Callosal Cisterna, and this cistern lies above the corpus callosum in the callosal sulcus, and here you will find the anterior cerebral artery, which is the other branch of the internal carotid artery. And finally we have chiasmatic cistern, which protects the optic chiasma. As we said before, the optic chiasma are the meeting points between the two optic nerves. These are collectively known as subarachnoid cistern, and you have now identified the importance of these subarachnoid cistern. Okay, now we have reached a very important part of our lecture, which is the cerebrospinal fluid and the circulation of this very important fluid. The cerebrospinal fluid lies inside the cavities of the ventricle and also in the subarachnoid space between the arachnoid and pia mater. The production or the structure that produces or secretes the cerebrospinal fluid, as you know, it's called choroid plexus. The choroid plexus is present in the floor of the lateral ventricle, so it appears first in the medial wall of the lateral ventricle and then coming to the floor of the lateral ventricle. And also it lies in the roof of the third ventricle, in the choroid fissure here, and in the roof of the fourth ventricle, as we mentioned before, in the lower half of the roof of the fourth ventricle. The circulation of the CSF is very important. So it first produced by the lateral ventricle choroid plexus. So the lateral ventricle choroid plexus is responsible for production of the CSF inside the cavity of the lateral ventricles. And then the interventricular foramen transmits the CSF from inside the cavity of the lateral ventricle to the cavity of the third ventricle on each side of the cerebral hemisphere. Then the only way that the cerebrospinal fluid escapes from the cavity of the third ventricle to the cavity of the fourth ventricle is through this cerebral aqueduct of Sylvius inside the substance of the midbrain. Then from the cavity of the fourth ventricle, it escapes by gravity to the central canal of the spinal cord and medulla oblongata. And don't forget that you have three communications in the roof of the fourth ventricle, from which the cerebrospinal fluid escapes from inside the fourth ventricle to the subarachnoid space. They are called Foramens of Lushka in the lateral angles and one foramen of Magendie in the median aperture or median lower communication between the inferior cerebellar peduncles. Then the cerebrospinal fluid circulates in the subarachnoid space around different structures, so around spinal cord and around cerebellum and also around the brain. And this circulation is very important because it makes as it acts as a cushion that protect different structures of the brain and spinal cord, and also it drains the waste products of the brain and spinal cord and cerebellum. But imagine if the cerebrospinal fluid is continuously produced from the choroid plexus and never absorbed. It will accumulate inside the cavities of the ventricles and will cause these ventricles to be enlarged and cause a condition known as hydrocephalus or hydrocephalus. So the hydrocephalus or hydrocephalus is increasing the cavities of the ventricular system due to increasing amount of the CSF inside these cavities. So the absorption of the cerebrospinal fluid is very important. And the structure that is responsible for the absorption of the cerebrospinal fluid is called arachnoid villi and arachnoid granulations. These are like finger-like projections inside the subarachnoid space here, and it projects inside the cavity of the superior sagittal sinus. The superior sagittal sinus lies completely in the upper border of the falx cerebri. If you remember, we have what's called dural folds. One of these dural folds is called falx cerebri, which lies between the right and the left cerebral hemisphere in the longitudinal fissure. The upper border of this falx cerebri is occupied by the superior sagittal sinus. So these finger-like projections, which is called arachnoid villi and granulations, they are absorbing the cerebrospinal fluid from the subarachnoid space and pours it into the cavity of the superior sagittal sinus. Then the venous blood carries the CSF back to the venous circulation of the brain and the venous circulation of the body towards the cavity of the right atrium. So finally, the CSF is poured into the venous circulation of the body. And these are the characters and the functions of the CSF, and this is very important to know the importance of the CSF in support the weight of the brain and drainage the waste product, and also it has a nutrient function. This is the photo of the ventricles and how is the CSF is circulating around the brain and spinal cord and also inside the ventricular system. And this is the subarachnoid space in the spinal cord, and you can see here the subarachnoid space is wide in this area here below the termination of the spinal cord. You may know the termination of the spinal cord is at the level between lumbar 1 and lumbar 2, and the meninges continues until S2, sacral number 2, and the widening of the subarachnoid space in this area below the termination of the spinal cord gives opportunity for what's called lumbar puncture and also injection of spinal anesthesia in this wide area without harming the spinal nerves, as you may discuss in the spinal cord. Okay, so just to summarize the circulation of the cerebrospinal fluid, you have two lateral ventricles which are connected through the interventricular foramen on the right and on the left side with the cavity of the third ventricle, and then the cerebrospinal fluid escapes from the third ventricle to the fourth ventricle through the cerebral aqueduct of Sylvius, which lies in the cavity of the midbrain, and then you have three communications or three apertures between the roof of the fourth ventricle and the subarachnoid space. You have two lateral foramens of Lushka and one median foramen of Magendie, and the arachnoid villi absorb the CSF and pours it into the superior sagittal sinus, and then the CSF is poured into the venous circulation of the body. And as we mentioned before, this is the lumbar puncture procedure which is the process by which we take the CSF for examination from the subarachnoid space. And the CSF is drawn by introducing a needle. This needle is introduced in a wide space of the subarachnoid area, which lies between third and fourth lumbar vertebrae. As we mentioned before, the spinal cord ends at the meeting or the disc between lumbar 1 and lumbar 2. So here you are safe to insert your needle, because you will not injure or harm any of the spinal roots or spinal nerves. And this is done for diagnostic purposes, or to produce or to inject an anesthesia, to do spinal anesthesia, in which you don't need to do general anesthesia for some operations. So you just produce this anesthetic material to just do spinal anesthesia for the lower part or the lower limbs, and also to measure the CSF pressure in some cases. And this condition here, as we mentioned, is called hydrocephalus or hydrocephalus, which is accumulation of the cerebrospinal fluid inside the brain. And you can see on the on this picture here how is this baby, the skull of this baby is very enlarged because of the enlargement of the ventricular system inside his brain. And this is very characteristic picture. And this baby will have double vision, and he will also have a neurological manifestation, motor and sensory. And the hydrocephalus may lead to vomiting or seizures. And also you may see this appearance of his eye, which is called sunset appearance, due to the CSF accumulation in the ventricles and pushing on the cranial nerves, and also affecting the cranial nerves that controls the eye movement. This is not for exam, but this is for your general information. You may need this information in the pathology lectures. As you may know, the hydrocephalus may be obstructive or non-obstructive, and it's called communicating hydrocephalus or non-communicating hydrocephalus. And you may have obstruction in the foramen of Monro or the aqueduct of Sylvius, or in the fourth ventricle itself, because of tumor or because of any space occupying lesion that affect these very tight areas in the communication between different parts of the ventricles. Or you have a non-obstructive hydrocephalus, and this is due to impairment of the subarachnoid granulations, and this causes non-obstructive communicating hydrocephalus. And this is the hydrocephalus, how hydrocephalus appears in the MRI. You can see on the left side, this is the hydrocephalus, and how the lateral ventricle and also the third ventricle is very enlarged due to CSF accumulation. Another pathological condition, which is called Chiari malformation, and this structural defect in the cerebellum, as you may see here in the MRI. This is called cerebellar tonsil. Sometimes the downward displacement of the cerebellar tonsils through the foramen magnum causes communicating hydrocephalus, because it obstructs the cerebrospinal fluid outflow. So here, this is the cerebellum, and this is the cerebellar tonsil, which lies on the inferior surface of the cerebellum, surrounding the foramen magnum. So sometimes you have a congenital herniation of this structure, which is the cerebellar tonsil, that passes around the medulla oblongata in the foramen magnum, and causes obstruction of the ventricular or the CSF circulation, and causes a non-obstructive communicating hydrocephalus. Obstructive non-communicating hydrocephalus, and you will find in this patient headache, dysphagia, and also may cause paralysis if it affects some of the roots of the nerves that emerges from this area in the spinal cord or the medulla. You have another condition which is called Babylidema, and Babylidema is optic nerve atrophy and blindness, which is caused by accumulation of the CSF in the subarachnoid space around the optic nerve, because the subarachnoid space is continuous or extending around the optic nerve to the back of the eye. And if you have a condition of rise of the CSF pressure, this will affect the retinal vein and also will cause congestion of these retinal veins and cause bulging of the optic disc. And all these phenomena are appearing when you see the eye by the ophthalmoscope, by the ophthalmologist, and you will find the picture of the retinal veins, like fanning of the retinal veins and retinal congestion like this, and this is easily to be identified by the ophthalmoscope. Okay, we will discuss now what's called blood-brain barrier. If you remember in the histology lecture, we were discussing what's called astrocytes. So the astrocytes are the type of glial cells that are protecting or plays a role in the blood-brain barrier formation. This is the barrier between the brain and the blood. So why not all medicines or not all harmful drugs or materials are easily affecting the brain? That's because we have what's called blood-brain barrier. The blood-brain barrier is formed by the capillaries of the brain. The endothelial lining of these capillaries have a tight junction between them, which makes like very thin pores in the blood vessels. And also the astrocytes completely covers the capillaries to make very tight pores between them. And finally, we have the thick basement membrane of the blood vessels surrounding the whole blood vessel. So you can see this is the capillary that supplies the brain, and you can see here this is the astrocytes. The astrocytes are joined together with very little space between them. These are called foot processes of the astrocytes, and these are the tight junction between the endothelial cells, and the basement membrane surrounds the whole the basement membrane is surrounding the whole blood vessel, and all these structures is responsible for what's called blood-brain barrier. Now you may ask why the CSF is not mixed with the venous blood in the superior sagittal sinus, for example. That's because we have what's called blood CSF barrier. The blood CSF barrier is lying between the blood vessels and the CSF, which lies at the choroid plexus. And this barrier is similar to the blood-brain barrier in function. So it protects the CSF from the materials that are surrounding the CSF inside the venous blood in the superior sagittal sinus. You have more clinical signs, which is very important in clinical examination of the CSF. You have what's called quick nested sign. Normally, the CSF changes when you change your position from sitting to lying down or standing. The CSF pressure changes, or the normal CSF pressure varying between 60 and 150 millimeter water. So in case of obstruction, if you compress over the jugular veins in the neck, the rise or the change in the cerebral venous pressure will not happen, and inhibition of the CSF absorption producing rise in the CSF pressure will not occurring in a normal way, and failure of this to happen is called positive quick-nested sign. So it is only present in pathological condition. So normally if you compress the jugular vein, this will make changes in the CSF pressure, and if it doesn't change, so there is an obstruction in the CSF circulation. Also, you may have in newborn babies what's called Kernectress, and this is because the newborn, the blood-brain barrier is not fully matured, and the bilirubin, which is toxin, enters the CSF and produce yellowish discoloration of the brain and the CSF. And this will appear when you take the CSF for diagnostic purposes. You will find some yellow discoloration of the CSF. This is because of the condition which is known as Kernectress. You may also know that some drugs are crossing the blood-brain barrier and some drugs are not. And you may be interested in reading the pamphlet of the drugs or the medicines that are prescribed by your doctor to see if these medicines will cause central nervous system manifestation like headache, vertigo, or whatever. And if these drugs are causing central nervous system manifestations, so they are easily crossing the blood-brain barrier, and some drugs are not. And here we reached the final part of our lecture. I hope that you are interested in the ventricular system and the CSF circulation. And I'm happy to hear your questions on Facebook Messenger or on the Teams, and see you inshallah in another lecture. Thank you very much.